Nasogastric tube insertion.
Hi, hello, good morning.
Good morning.
Is this Mr. Ansari?
It is, yeah.
Hi, hello, good morning, sir. So my name is Irene Martinez. I'm the nurse looking after you today. How are you feeling?
I'm okay. I feel a little bit sick today.
Oh, I'm so sorry to hear. So the reason why I'm here is just reviewing your notes. I can see that you've been admitted for an elective colostomy, am I right?
Yes, that's right.
And it's been advised for you to have a nasogastric tube inserted in. Have you had any nasogastric tube before?
No, I haven't, no.
Oh, okay, no worries. So basically it's a plastic tube that we need to insert from your nose all the way to your stomach. Okay, it's not very pleasant procedure. It tends to be a bit uncomfortable sometimes. So don't worry, I have done it before. I'm experienced nurse, and if you need a break or you want to stop at any time, please do let me know as well.
Okay, thank you.
Thank you so much. So before I start, I'm just going to do a quick hand wrap. Before starting the procedure, we will need to make sure we have oxygen working and also a suction machine working. Perfect, thank you. Where I name from. So we will start preparing all the equipment. We need to make sure that the trolley that we will be using it has been cleaned on the last 24 hours. And the equipment that we will need for this procedure, it will be an NG tube that we will check expiring date and make sure it's in date. We have a 60 ml syringe for aspiration that is in date. We will also have our pH indicator strips that they are also in date. We will have a receiver. We will have warm water for lubrication. We will also have our gloves, so they are in date, detergent wipes for cleaning, and alcohol that is within date. Okay, so before we're going to make a start, what we need to make sure is that you are sitting in the correct position. Okay, so I need you to be sitting upright.
Okay.
Do you need any help with that?
No, I'm okay, thank you.
That's fine, and then I will just place some pillows behind your head. Okay, just to make sure you don't flex your neck during the procedure, okay?
Okay.
Let me just put some pillows, perfect. And also, Mr. Ansari, what we need to do is to arrange a signal, so when you need to break, when you need to stop, you need to let me know, because you will not be able to talk. Will it be okay for you just to raise your right hand for me?
Okay.
That will mean that I will stop and just give you a break.
Okay, great, thank you.
That's fine. So, we're gonna open equipment, and we're going to have our NG tube, nasogastric tube that we will be using, and we need to start with the measurement. Okay, so in order for us to know the length of the tube that we will be inserting, we will be measuring from our nose to the earlobe, from the earlobe all the way up to the sternum, and we will have to add 5 to 10 centimeters. That means all the way up to 53 centimeters, okay? So for me to remember easily, we will just have the marker and just mark it on the end nasogastric tube. That's fine. So the next step is for us to lubricate the first 15 to 20 centimeters of the tube with warm water and place the receiver next to the patient, just in case the patient is feeling sick or there is any gastric content coming from the tube. Alright, are you happy for me to start?
Yes, that's okay,
Fine.
yes.
So before we're going to start, we need to make sure we do a nostril assessment. Okay, so I need you to first press on your right nostril and breathe through your left one.
Okay.
Okay, it's done. And we're going to do the same with the other one, so I'm going to be pressing on your left nostril, and then you're going to breathe through the right one.
Okay.
Fine. So you were able to breathe with no problems from both. If you're happy with me, I will just use the left one if that is okay. That's fine. Perfect. So we're going to start inserting the tube through your left nostril. That's fine. How are you feeling, sir? There's any, we will be monitoring any signs of coughing, patient distress, or cyanosis. It's going very well. You're doing great process. So I have the feeling that the NG is now at the back of your mouth. So what I need you to do to help me with the insertion is to start swallowing. So you're swallowing the tube at the same time. Well done. Continue monitoring the insertion. So we are on. Okay. That's correct. Okay. So according to the measurement, I believe I'm in the right place. So we're just gonna place the dressing to secure the NG tube first on your nose. And the second dressing. Good. Cheek, that's right. And then to ensure that the nasogastric tube is inserted in the correct place, we will need to aspirate some gastric content and measuring the pH. So we will attach a 60 ml syringe, aspirate some gastric content. You're doing a great job, sir. And on a gallipot, you will expose the gastric. So we will get one of your pH strips. Dip it to calculate your pH. Remove the excess from the edges. And following infection control, without contaminating the bottle, you will compare the pH on the strip against the pH indicator on the bottle. So I can confirm that your pH is 3. So what we're looking for is a pH below 5.5. So with a pH of 3 means we are in the right place. So well done. Obviously, we will need to continue monitoring your pH every time we're accessing the NG tube or any feeding. Okay, just to make sure that the tube hasn't been misplaced or anything has changed. So the procedure is done now. How are you feeling?
Okay,
You
yes.
okay? So we'll remove the pillows from your back. Do you want to stay in this position? Let me know if you want to be repositioned at any point.
Yes, no, I'm comfy, thank you.
That's fine. So I'm going to leave you the call right here. If you need any help, please do not hesitate to give us a call. Okay, and we will come in and assist you as soon as we can.
Thank you.
Thank you so much for your cooperation. So we're going to dispose all the equipment in the clinical waste bin. Alcohol in your hands, and before starting documentation you will perform a full hand washing, and as part of the documentation you will complete your pH reading and the length of the NG that you have inserted, and you will clean your trolley with detergent wipes and leave everything the same way you found it.